We talk about a lot about people sitting, sedentary lifestyle. We know what is happening, so you deal with that as well. Sedentary lifestyle causing diabetes causing decreased blood supply, and then we talked about the peripheral vascular disease. How about people who are standing all the time? What are the problems that they can have?
So prolonged standing, basically what it does is you have this heart. The second heart of your body is your calf muscle. Okay? So this heart will take the blood down, and that second heart has to send the blood back to the heart. When it's not doing its job, then blood starts pooling in your legs. So how do you do that? If you're standing and not moving your legs continuously, the calf muscle is in one position. So the complex medical term for that is resting ambulatory pressure rise, we say. But basically what we're saying is, if the calf moves more, then blood is pumped back. If you stand like that and don't do much, like for example, our cameraman will stand for 2 hours now, right? Or even like this, even when we sit and do this, there's nothing happening in the legs. In fact,
Correct.
if you ask me, sitting is the worst thing that was discovered in the mankind.
Is it right?
Yes.
Why sitting is that bad?
Sitting is the new smoking, if you ask me. Yes. In fact, most of Stanford, they do walk views. So interviews are done by walking in the farm in Stanford. So there's a lot of stuff happening now. So whatever be the cause, prolonged standing or sitting without moving, maybe you're an IT employee, 8 hours you sat and done some coding, let's say. This blood is pooling in the legs. And this pooled blood struggles to come back. Because more and more blood is pooling there. And when it struggles to come back, it starts producing what's called as venous incompetence. Long story short, the veins are not competently sending the blood back to the heart.
Because the load is too much.
Load is too much. And the muscle contraction is of very poor quality. Hence, you get varicose veins, which is basically veins, blood pooling in the veins. Or you may even get deep venous thrombosis, whatever. Both together now we put under one group called venous incompetence.
So when the veins are not working properly, the legs swell up.
Legs swell up.
How do we know whether we have varicose veins?
Legs swell up for various reasons.
Correct.
So you can do a bunch of tests. But I believe very early in the course of a leg attack, like I said, sudden pain, sudden swelling, sudden color change, something like that. When you get that, very early you should do what's called as a Doppler. This Doppler test,
it's like an ultrasound.
It will tell you very simply whether the blood is pooled or not. Simple ultrasound is available in every small village in this country. Will easily tell you whether you have varicose veins or not. So bottom line, pain or swelling in the leg, always get a Doppler in standing position to check if you have any vascular problems. This is something that we should write down and underline, in my view.
Only if you have diabetes or any risk factor or anybody?
Anybody.
Obesity?
For me, if you ask me, the risk is just a standing profession itself is a risk. If you're a hairdresser, let's say, you're doing like an hour cut and the next guy is sitting another hour, 1 hour cut to blow or try and all. So all this will make you a lot of blood pool. That itself is a risk factor. Such a person, if he has any leg pain or leg discomfort, should definitely get a scan early in the course to identify the problem.
And what happens if we don't do anything about it?
So a lot of things can happen. So to be frank, I was shocked when I came back. I never thought there'll be so many varicose veins, right? So then I did some literature research, and when I was in US, we did, and bother, and bother, I did so busy life or so. 25 to 30% of Indians have varicose veins. So first of all,
wow,
you see the total number of people, it is more common than cataract.
Seriously?
Yeah. Now, not all of them will have symptoms, so not all of them require treatment. That's a different discussion. Even if 10% have symptoms, you still are talking about 180 million Indians, right?
Correct.
Because our population is huge. So we do have a lot of people with varicose veins who are not treated. And if you don't treat them, initially these veins can swell up and it can look like a bit of a cosmetic problem. But once it crosses that phase, and very often it does, and there's only one study called Bonn vein study out of East Germany, it says that 17 to 20% of them will go to next stage and next stage. And so other 70% will be like that only. The remaining percentage of them will go to the next stage. And the next stage are color changes. Legs become black in color. You'll get ulcers in the leg. You'll get, easy bruisability. Small injury also will not heal.
Because there's no blood supply.
No blood supply. And the worst possibility is these clots form in the leg and they migrate to the heart. So It's very rare, but it does cause emergencies. Okay, and sometimes you get frequent infections, and they become cellulitis and septic. So bad infection is called cellulitis. So that can also happen. All these are very avoidable complications.
What kind of treatment that you can offer for the varicose veins?
True. So basically now all vascular care, and this is something that I should probably tell that for people's benefit as well. Virtually most vessels can be fixed from inside. So the whole world has moved towards a concept called endovascular first.
So no surgery.
No surgery. So effectively, you don't have to open up and do anything until needed. I mean, of course, there are circumstances where you have to open up and do it, but that's very, very rare and becoming increasingly rare in the world, especially if you see advanced countries. So what we can do is called endo, that means inside, vascular or venous, some way of burning the vein, which is laser ablation. Now we do what's called as glue ablation, which means you go inside and put a gum, and the gum will just freeze the whole vein or just...
What do you mean by ablation?
Ablation means burning.
Burning the whole thing.
Burning the vein. Okay.
Not painful?
It's not painful at all because, again, good doctors are very precise in what they burn. So they're not burning the whole thing, and they're not burning the deep veins or any vital structures. Equally, we give some little insulation around that vein. So that should make sure the burn is not touched by other areas. It doesn't touch the other areas. So I think that's also, so it will not hurt if the doctor is very capable.
But what happens when it burns?
When it burns, this extra useless vein is removed.
It gets destroyed.
Correct. You have the highway, you have the service road. Highway is going well only. Everybody is coming in the service road and crashing each other. So what this endovenous laser is, I'm shutting the service road and saying everybody go one way in the highway normally, properly.
Okay.
We're just removing one accessory road,
Okay.
which we have identified as not good on scanning. We don't remove normal veins.